Jeremy Zegas joined Healthcare Rising Arizona as a regional political organizer in June of 21, last year. Has been working in the political and campaign field since 2008. He moved to Phoenix from the Pacific Northwest, I assume, where Seattle area or something?
Yeah, exactly.
In 2014 to work on marriage equality. He's worked on campaigns at all different levels, local to statewide, in a wide variety of roles. Now, this is the important part. When he's not doing politics, Jeremy loves to travel and is a below average ice hockey player. This is Jeremy, and you're up in Phoenix, right, Jeremy?
That's right.
And so why don't you, if you want to say anything, then I can share a screen and put up your proposal that we're going to be voting about. So you want to say anything first before I put it on?
Yeah, thanks, Paul, thanks, George, and thanks to all of you for making time and letting me join your meeting today. I really appreciate it. And this is certainly the best organized Zoom meeting I've ever been a part of with the camera situation. That's great. And yeah, I'm really excited to talk to you all about what we're up to here at Healthcare Rising, particularly in regards to the ballot measure that we're working on this year called the Predatory Debt Collection Protection Act. And with that, yeah, if you want to throw it up on the screen,
okay, let me put it on.
And I'll go ahead and get started.
Let me be sure it's there. Do we see it, Jeremy?
That's it.
Okay.
Well, great. Thanks again, everyone. I, again, really appreciate the opportunity to speak with all of you. What's up on the screen is just sort of our two-page summary of the ballot measure we're working on. Before I jump into all of that, I just want to talk a little bit about who we are as an organization and what we're working on. So for the folks who aren't familiar with Healthcare Rising Arizona, we've been around for a few years. As Paul mentioned in the introduction, I joined this past June, but the organization has existed for, I think, about 4 years or so now. And what we do is work to make healthcare more accessible and affordable for folks here in Arizona. Obviously, that's a pretty heavy lift. So we have a lot of work to do in that regard. And given the makeup of our state legislature, sometimes it can be really hard to get anything proactive and progressive done on the healthcare front through our state legislature, as you might well imagine. And so quite often, one of the things that we've found as an organization is our best opportunity for success for accomplishing our healthcare goals is to use ballot measures. And that's exactly what we're doing this year. So as an organization, we've got over 800 dues paying members from around the state. They come from all different backgrounds. So you don't have to be like a healthcare worker or anything like that, although many of our members are nurses and other healthcare workers or retired from that field. But we have all sorts of members, including several state legislators, which is exciting for us as well with the legislative session getting underway. So as this year, as we were starting to look at the 2022 election cycle and trying to figure out what was the best way that we could start making some progress on helping folks from a healthcare standpoint, excuse me, one of the things that we did was reach out to our membership and ask them what their biggest challenges in the field of healthcare were. And one of the things we kept hearing about, and sort of the genesis of this ballot measure movement, was people who are struggling with medical debt. Medical debt is a huge problem, not only here in Arizona, but of course, nationwide. But specific to Arizona, between 1 in 5 and 1 in 6 Arizonans, due to the extremely high cost of healthcare, have a medical bill right now that is past due and is in collections. And we know that nationwide, over 2/3 of all bankruptcies are due entirely, or at least in part, because to medical debt. So this is a huge problem that's facing a lot of people. And what's really interesting about it, and the reason we chose to address this through a ballot measure this year, is because Arizona actually already has on the books some protections for folks who run into trouble with medical debt or with other sorts of debt, and might be subject to losing their car or their home or having their wages garnished. So there are some protections that exist right now in Arizona law. The problem, and one that we realized we could address through a ballot measure, is that those protections are out of date. Those laws were passed in the 70s and early 80s, and the levels to which they protect people don't actually protect people, very many people at all, in reality, given the reality of today's economy. And so what we would do through the Arizona Predatory Debt Collection Protection Act is update those protections that, again, already exist in our laws to levels that make sense today, and then attach a cost of living adjustment that's tied to inflation so that we don't have to go back and do this again in the future. And then added a few other things just to strengthen protections for folks who are dealing with medical debt situations. So I'll just run through what those protections are really quick. And one of the really nice things about this ballot measure is that it's only 6 pages long. And it's almost entirely original language from existing Arizona state law. And again, what we've done is gone in, changed the numbers, and then tweaked some of the language a little bit to make sure it's a little bit more protective of folks and does what it's intended to do. So right now, let's say you are in debt, whether it's medical debt or any other sort of debt you might have, and you've got debt collectors coming after you. There are 4 things right now in Arizona law that are exempted from debt collectors repossessing from you. So there's what's called the homestead exemption, which exempts your home. But right now, that exemption only kicks in if your home is worth $250,000 or less. Now, the median house value here in the state of Arizona is just about $350,000. Up here where I live in Phoenix, it's over $400,000. So as you can understand from that, not a lot of homes are actually being protected by this. So we would increase that exemption to $400,000. So we're protecting at least the median home value in Arizona from being repossessed. There's a household goods exemption. Right now, it's only $5,000. I think with the value of TVs and computers, even just an iPhone, things like that, if you look around your house, things are going to add up to over $5,000 pretty quickly. And so we would increase that exemption to $15,000. There's also a vehicle exemption. Right now, vehicles are exempt up to $6,000, which is considerably lower than the average price of a used car today. That's actually lower than my decade-old Honda Civic. So what we would do is increase that exemption to $15,000, which is about the average price of a used car today. And then tied to that, there's a slightly higher exemption for folks with disabilities who have specialized vehicles, because obviously those are worth a lot more. So that exemption goes up to $25,000. And then the final exemption, and I think the most egregious one, is right now only $300 are protected from, in your bank account, are protected from debt collectors. They can take anything beyond that. $300 isn't going to help you pay rent. It's not going to help you pay your APS bill or anything like that, especially in the summer. So what we would do is protect up to $5,000 in people's bank accounts from debt collectors. And again, all of these numbers are going to adjust annually for inflation. So obviously an issue that's been on a lot of people's minds recently. So again, we're not going to have to redo any ballot measure like this or go back to the state legislature in the future. 2 other quick protections that we are addressing with this ballot measure. One, right now, up to 25% of your disposable income can be garnished from your wages every month. We would lower that to 10%. And then finally, and this is the one actual change in Arizona law, the only place where we're actually adding language is we are, for the purposes of interest rates, providing an actual definition of medical debt as being something that's separate from any other debt you might owe. And for medical debt, what we're saying is that there should be an interest rate cap of 3%. Right now, medical debt is treated like all other debts because that definition does not exist in Arizona law, and therefore is subject to a limit of a 10% compounding annually interest rate. So I just think that that's absolutely way too high. That can spiral out of control very quickly, and which is why we are putting in place that 3% interest rate cap on medical debt. And that's all the measure does. And as I was saying before, the nice thing about this is that it's extremely simple. This isn't like a revolutionary bill or anything, but it's going to have a real impact on the lives of a lot of Arizonans. There are a lot of people struggling with debt, people who are in danger of losing their homes, losing their cars. They're having their wages garnished. They're stuck in a cycle of bills that they can't pay. And this is going to have a real impact on their lives. And that's why I'm very excited about this ballot measure, and we'd love to have your support. We were endorsed by the state party, but we're going around and want to make sure we've got the support from all the local party organizations as well. So happy to answer any questions you may have, and talk more about this if you need more information.
Okay, Jeremy, did you want me to show the second page of this while you're at it?
Sure. Yeah, we can sort of run through some of the talking points. I was talking a little bit about how people's lives can be destroyed by excessive debt and predatory debt collection practices, massive interest rates. Those are the things that we're trying to address here. And to me, this is a simple an issue of basic fairness. You shouldn't become homeless. You shouldn't lose your home because you fell into debt because you had a huge medical bill you couldn't pay because you got sick, or you were in a hospital for a month, right? That shouldn't ruin your life. And we're strengthening these protections in Arizona law because we think your life shouldn't be ruined because you had a bill you couldn't pay. It's that simple. And we don't need to add any additional struggles to folks who are already struggling financially.
Okay. So here's what I would say. If anybody has a comment, you can put in the chat or turn on your video and your audio if you have something you'd like to say. I guess one of my questions is, Jeremy, what's the next step that we take to try to get this going?
Great question. Yeah, I meant to mention that. So we are in our petition signature gathering phase. We kicked off actually shortly after I joined the organization in the summer of 2021. I think we were collecting signatures by the end of June, early July. So we have both, a paid organization that does this professionally, and then we also have a number of volunteers and field organizers who are out and about all over the state collecting signatures. It's going pretty well so far. I think we are on track to reach our goals. We'll have to turn in our signatures in July this year. So we're feeling good about that. But one of the things we would love is if you all have any events coming up or any places where our folks can be out collecting signatures, please let us know. We'd love to be there if possible. And yeah, any help we can get on that front is always appreciated. There's it's a big number. We have to get to 237,000 and change valid signatures. So obviously our goal is to, collect roughly double that, just to give us a good buffer.
Okay, so that's a good 237,000 is your target, and plus more.
Exactly.
Or did you have something you came on?
I was going to ask, yeah, we had a petition palooza earlier last year, and you were part of our initiative to get as many signatures as you can. There's been training going on up at the PCDP headquarters. I will be there Thursday. It's from 11 to 4. Is that just training, or is that to pick up petitions? And do you know what that's about, Jeremy?
I'm not sure. Let me check with
Okay.
one of my Pima County connects.
Okay.
But I'd imagine we have some sort of presence there.
Yeah,
if
I want to
possible.
make sure that we pick up more petitions because I think we're out or we've got very few. So yeah,
Great.
we do have ongoing outreach events, and so we make sure that we've got petitions here. Um, Now, when you're about when this shows up on the ballot, how will it show up? Will it show up as a prop, or will it show exactly what will the title be if we were to vote for it on the ballot?
So we won't know that until it qualifies. So we'll be spreading that word, once we've turned in all of our signatures and gone through that whole process. But yeah, it will be with the rest of the ballot initiatives. So we are a statutory ballot measure rather than a constitutional amendment.
Constitution. Right.
So yeah, it'll be sort of in that section.
Okay.
All right.
And
Of the,
one other
prop to whatever, right?
right, exactly. One other question for you along those same lines. The I've had a couple people come to me and say, well, should I sign this? They're a little bit hesitant because there are some things being said about this from the oppositional side. What kind of feedback should you give us, and can you give us maybe some to spare people to sign this because it is such a great initiative?
Sure. Well, first, I would love to hear sort of what pushback people are hearing, or why people think that they shouldn't sign. And then I'd be happy to address any of those.
Okay.
But I think people should sign because it's a ballot measure that again has a huge impact on real people's lives, and it doesn't cost the state a dime. There's no hidden tax increase or anything like that. This is something, the only impact, I think, and I think that, our likeliest opponents, and we thankfully don't have formal opposition yet. We do anticipate that changing at some point. But our likeliest source of opposition would be from the debt collection agencies and the lawyers of the debt collection agencies, which is fine. Like if they want to oppose us, that's fine. I don't think they're a particularly sympathetic group. But yeah, so would debt collection agencies make less money from this? Probably. But for the regular people, everyday Arizonans who are going to save money and stay in their homes, I think that's totally worth the trade-off. But yeah, if folks are hearing anything or people are giving them a reason not to sign, I'd love to hear that and just sort of address any of those concerns.
Okay, Jeremy, a couple of texts, or not chats, I mean. Henny asked, how is the petition signing going now?
Yeah, it's going really well. I don't have an exact number on me right now, but we're on track to hit our goals to have enough valid signatures to qualify. And we're getting from the folks who are out there in the field. And to address the next question I just saw in the chat, yeah, we do have paid signature gatherers. We've also got a lot of volunteers and other staff who are collecting signatures as well. So it's a mix of both. And the feedback we've been hearing from the folks who have been out getting signatures has been overwhelmingly positive. The questions come up here and there, but for the most part, people are pretty enthusiastic about signing.
Okay, good. And you can read those, but I'll read them out, I guess. Are there brochures which we could distribute to people in our HOA neighborhood, for example?
Sure. So the closest thing we have to a brochure is that one pager I just had up on the screen. Please feel free to print that out and distribute, and I'm happy to send those down to you if you need more copies. So we don't have any like pamphlet or literature packet just yet. I think that'll probably change as we get a little closer to the election, but for now we've got that one pager.
Okay, and there's a two-part one from Lois. What sanctions are there for debt collectors who violate the law? That's a good one.
That is a good one. I'm actually not sure about that. That's I'd have to do a little research on that front. I'm happy to check in and send an answer your way by your next
Life in
meeting.
prison, life in prison.
Yeah, there we go.
Okay.
There we go.
That control them, wouldn't it?
Exactly.
What's the goal for the number of signatures? You had
Yeah,
said
so we need 237,000 and change. Our sort of like internal goal is roughly double that, so just short of 500,000.
that's in case, just in case, right?
Yeah, you know, there's always challenges to signatures. There's a lot of sort of technicalities in the law as to why signatures can be thrown out. You know, people who accidentally sign twice, you know, we're collecting signatures for over a year. People aren't going to remember if they, you know, signed a year ago, right? So there's all kinds of reasons, unfortunately, why signatures could be thrown out or invalidated. So just to have that buffer, we like to go well beyond the number required.
Right. No, I could say, George, help me out here, but I think if people do want to raise their hand, they can go to the reactions down there, click on that, and maybe hit the hand symbol if you want to say something, or just turn on your video and audio and you can ask a question. I think that'll work too. So Jeremy, I have a thought. I just wanted to know about this. Can you give us some examples of people who have lost a lot of money or property through having debt, through having medical debt?
You know, it's something that we know happens a good bit, both here in Arizona and nationally. I don't have names. I don't have like one story of someone who like actually had their home repossessed. I do know that it happens, unfortunately. One story that I do have that I think is pretty illustrative of the problem. You know, unfortunately, this person was able to pay down their debt just because they happened to be quite wealthy, or at least had enough money in the bank. But just to show how this, you know, through no fault of anyone, can spiral out of control very quickly. There's a woman named Sherry Greer, who's actually the sponsor, the citizen sponsor of our initiative. And she's now a retired nurse, but she was working as a nurse just before the pandemic hit. And right before the pandemic hit, she was diagnosed with a form of cancer. And then once COVID happened, her doctor told her that it was not safe for her to be going to work in a hospital with her condition. And she opted for an early retirement. And when she did that, it actually changed her insurance plan slightly. And so when she went in for a cancer treatment, she let them know, hey, my insurance plan has changed. I went from this to this. You know, do you still take this new program that I'm on? And they said, oh yeah, that's totally fine. Went in for a treatment, came out, went back to the billing department of the hospital. And they said, hey, I don't know who told you that we take this insurance plan, but we do not. And she was handed a bill for over $40,000 for one treatment, a treatment that she needs on a fairly regular basis. That wasn't the type of money she had just sort of lying around, like most folks, and was in a real difficult situation, you know, as a retired person. And ended up having to negotiate with the hospital and with the collection agency. The bill went down to $20,000, sort of got on a payment plan, and was lucky to sort of have enough wealth and assets that she was able to eventually pay this down and fix the situation. But you can see from that example, not everyone has that kind of money. Not everyone, you know, is in that sort of situation where they could deal with a $40,000 or even a $20,000 bill. You could very quickly run into trouble with debt collection agencies and have very little recourse. So folks like that are who we're kind of looking out for.
I'm going to ask you pretty soon about the rising cost of medical care, because I know it's going crazy, but Lois has a question. So Lois?
Yeah, not so much a question as an observation. Even though, say, a hospital or a physician's practice does not take a specific type of insurance, doesn't mean that the insurance company is off the hook. The example you give is that nurse could have submitted those bills herself to her insurance company, who would then either reimburse her or pay directly based on her instructions. So that while that example is meaningful, I think there are people who would poke holes in it for the very reason that I just mentioned. And that may be more a case of people not understanding how insurance companies work if a particular entity does not accept direct pay from them. So I'm just throwing out that observation as something to be careful about when you're giving examples. Thank you. And the reason I know that is I worked as a benefits administrator for a hospital network. So I had a lot of experience with, not a lot, but I had some experience with that. Thank you.
Good to know. Yeah, thank you.
All right, so Jeremy, what's happening? I don't know if people understand we're at the age now where things happen to us, right? We're old cars, need to get fixed. And what are some of the, let's say, costs that you might face for just let's say an overnight stay at a hospital, or setting a broken arm, or you name it, anything? I know it's high.
Yeah, and I think part of the problem, and I was actually just talking to a friend of mine who's an ER doctor up here in Phoenix, and part of the challenge is that there isn't an easy answer to any of those questions, right? Those costs can vary wildly depending on the circumstance and which hospital you go to and your insurance coverage. They're incredibly difficult to anticipate, and that's a huge part of the problem with sort of how we do healthcare in this country, and just how the doctor or how the provider codes that and reports that back to the insurance company can make a huge difference in terms of the costs. I actually was recently in an emergency room not far from where y'all live, down in Green Valley, just last week. It's totally fine, just had an asthma attack, forgot my inhaler, it's okay. I was fine. But I haven't received a bill yet. I anticipate it will be quite high, despite the fact that I was there for maybe an hour and got one treatment. So yeah, the fact that I don't know what that's going to cost me, but it'll probably be a lot, sort of, I think, tells us all we need to know about the cost of healthcare in this country.
It won't be a couple $100. I have a family member, and I'll get you this information when I can get it, who got into a head-on collision, several broken bones, was in the hospital for at least 2 months with surgery, and then was out for a month and back in for another month. I'll let you know how much that costs. I can't imagine it's less than a couple $1 million.
Oh yeah, absolutely.
And I'll let you know that, and you can use it if you want to. But I'm thinking that a week in the hospital is going to be extremely expensive. Maybe somebody here has an example that they can tell us about.
If I may share my own personal story, you probably heard hundreds and hundreds of them, but you don't think this stuff would happen to you until it does. About 7 years ago, I was diagnosed with cancer. It was pretty advanced. It was prostate and bladder. And I started going, I had some surgeries, and I had chemo, and then I had more chemo, and it went on for like 8 months, and I had to have blood transfusions, and ambulance came a few times. And it was, it was all pretty awful. But then we started to see the bills, and we started to see the impact. And I remember when they came to me, Lois and I were pretty much on our own, and I was so sick. And they said, well, the best treatment for you is this certain chemo, but it's really expensive. and I'm thinking, well, a couple $1,000. No, it's like $40,000, $50,000 over a period of like, I don't know, a couple months or something like that. And my doctor said, you got no choice, you just do it and worry about how you're going to pay later. And then, I mean, how does an honest person pay for that? I was on Medicare. Medicare would pay just a little bit. I was getting bills from different doctors. Ambulance sent me separate bills. And it was like, how do you deal with all of that? I mean, by the time this whole thing was done, we seriously considered bankruptcy. But I can see how this happens to people. So I'll share that story. I'm sure you've heard many like that.
That was good.
Yeah, no, and thanks for sharing that. And yeah, there's unfortunately a lot of stories like that. I wish we could pass a ballot measure that would, limit the cost of all healthcare. Unfortunately, that's not in the cards. That's not something that we can simply do through a ballot measure. That's going to be a long process over years of state, local, federal campaigns. But one of the nice things again about this measure is that, while we can't, cut your bill, we can protect you from the debt collectors who could come after you if you have a bill like that. And
Yeah, this is great. Thank you for doing this.
Mhm.
thank you.
Yeah, this is a very important situation, especially for people like us down here. I don't understand mathematically how the insurance companies can have enough money to pay these bills. It's too much. It's like way, way, way higher than we pay in as insured people. How are they going to have enough to pay out? So I'll go ahead, George, you had something.
Well, I was just going to say, the good thing about this bill, it does not cost the state anything. And so I'm like you, Jeremy, I do not see how anybody would be against it. It just helps support the families. I was looking at the information you have on your second sheet, which is some good talking points if people come up against some people that are hesitant to sign it. And, 30% of Arizonans have debt collection, and it's higher than the national average. And in communities of color, especially in our tribal areas, it goes up to 45%. So they're very vulnerable to these medical debt collectors. So thank you for doing this and being a part of this.
Yes.
Yeah, thank you.
All right, anybody else? Let's see if there are any more, no more chats. Jeremy, you did a great job presenting this, but
I had my hand up.
oh, Lois, go ahead.
Yeah, I just want to mention about the question about how insurance companies can afford to pay out all these debts. They don't pay the full amount, bottom line. For one thing, those that have insurance companies that have contracted with providers the providers agree to accept a certain percentage or a certain amount depending upon the procedure. That's why those contracts are so important. So the actual in the case that you mentioned, Jeremy, the bill was $40,000. Had there been a contract between the insurance company and the hospital, that bill might have only that they agreed to accept. The hospital would agree to accept maybe 30,000 and forgive the other 10,000.
Yeah,
that's the kind of thing that happens. I'll be honest with you. I have when you see the wealth of insurance companies, I have very little sympathy for them. But that's part of how they can afford to pay those. The providers often will prefer to take a lesser amount because they know they'll get that. Whereas if they might, in this case, Jeremy, you talked about, they might have been out the full $40,000 trying to get, you can't collect $40,000 from somebody who's bankrupt, for instance. So they might have gotten 10 cents on the dollar, something like that. So they play that game of balancing the pros and cons. So I just wanted to make that observation. Thank you.
Yeah, thank you. Yeah, and I think that's a great point to bring up. And then one thing I actually forgot to mention that we're doing right now with our signature gathering campaigns, and Lois, you mentioned retiring of debt. We are actually partnering right now with an organization called RIP Medical Debt. And for folks who aren't familiar with them, they're a nationwide nonprofit. And what they do is they actually buy up and retire medical debt that people can't pay. And they're able to do that for pennies on the dollar, really. These are long past due medical debts that they're able to buy up and retire for people. And so we have, excuse me, because of our partnership with them, what we're doing is making a contribution of $1 for every signature that we gather from our volunteers is going to RIP medical debt, to retire medical debt. And right now we've contributed enough to them from our signature gathering drive to retire $1 million worth of medical debt here in Arizona. So that's pretty exciting. And we're looking to blow past that.
Oh, that's great. Okay, Jeremy, let's say this gets passed, right? And then how do people proceed if they are stuck in this kind of one of these situations? How does it operate exactly at that point?
So basically, what will happen, as I understand it, is that, you know, if you have a bill that you can't pay, it's in collections, you've got a debt collection agency, what will happen is simply that collection agency won't be able to won't have the legal recourse to, say, repossess your home, your car, or whatever, if they're up to the, as long as they're below the exemption levels that we're raising as part of our ballot measure. They won't be allowed to charge or to garnish up to 25% of your wages. The cap will be at 10%. So they simply will not be legally allowed to do that. I don't know if you'd have to like take a debt collection agency to court to prevent that, but it will be illegal by Arizona state law for a debt collection agency to garnish more than 10% of your wages, or to repossess your goods if they're below the exemption level, or to charge more than 3% interest on a medical bill or on a medical debt. So yeah, those legal protections will be there. And should debt collection agencies try to violate that, you would have legal protection.
Right. So it'll become a law. They know what the law
Exactly.
is. They have to
Yep.
follow it. So the guidelines of it. So George, you had something?
I just was going to say I'll be up there, and I noticed I read a little bit further. They're going to be supplying us with petitions, and so I'm sure they're going to have your letter. I will pick up letters like this and put them in our headquarters office. So anybody has more questions, or you'd like to take this out and share it with your neighbors, it's a great piece of literature to have just to read over yourself.
Anybody else have questions? You know, there's got to be some. So, but anyway, if not, Jeremy, you've really provided some good information for us, and I hope it goes. It looks like it's going to. Seems like we'll get those. Who can be against it? Lois and Mike Norman have their hand up. Go ahead again. Lois or Mike?
Yeah, I'm sorry. My hand wasn't up. I was just applauding.
Oh, you're applauding. Oh, good.
Wonderful. Thank you.
Yeah, good. That's good. Go ahead,
I want
George.
to thank you all for being a part of this program. It's Jeremy, this is a very worthwhile bill, and we'll continue to have petitions at headquarters, making sure we can get as many signatures as possible to get you on the ballot, because it's a great program. I want to thank everybody for attending today. Our RIP medical debt, I kind of laugh at that. Rest in peace. Is that kind of the way that looks?
Exactly.
So, however, we are recording this. We will have this up on the website. Remember that if you didn't get to see it, or you want to share it with your neighbors, let them know that our website has this video up there, or any of the other videos that if you missed any of them in the past. Jeremy, thank you for being here today.
Sure. And I just wanted to point out, I've thrown my email address into the chat. So if anyone has questions you didn't think of, or things that come up while you're out talking to folks, please feel free to reach out to me. I'm happy to follow up.
Yeah, just give us the information we need, and we'll spread it and do what we can.
If you haven't had a chance, you can go down right now and save your chats by clicking on the 3 buttons, and just save them to save your chats, and that's all you need to do. All right. If not, that's it for today. I want to thank you all for being here. Please help support keep our headquarters open. Go to the website and make your grassroots contributions. Donate. Keep headquarters open. Thank you all for being here. We will see you next month.
George, it's
Uh-huh.
Lois Connell. Quick question on that. Does Act Blue charge anything for, say, the Green Valley Dems having people
They do.
contribute? What
It
is
doesn't
the
cost, it doesn't cost you anything. It costs us to operate that system. And we have to have that in not only in this campaign, but several others. So it's just a part of our expenses. It's a percentage. I do not know off the top of my head.
Okay.
Okay, but if you want to, I'll look it up and get back with you. I can let
Okay.
you know on Wednesday. Okay.
That sounds good. Thanks a lot, George.
Okay, sure.
I see Arlene. Did you have something to say, Arlene, or no?
No, except I believe it's a nominal fee, Lois. It's not that much in the great
Not
scheme
that
of
much.
things.
Okay.
No.
Yeah.
Yeah, it's a small percentage and worthwhile paying. It's not like
Okay.
a credit card or a debit card. So yeah, it's pretty easy.
I was
And
gonna say-
I did want to just thank Jeremy for speaking. When we were doing the petition signing, it was always kind of hard to explain to folks what that one was. And so it'll be easier to explain now. Appreciate it.
Great. Thank you all so much. I really appreciate you all making time and appreciate your support, and you'll enjoy the rest of your weekend.